Well, welcome everybody. We're so glad that you could join us for another virtual event. We have the honor of talking with Chris Jenkins here, Dr. Chris Jenkins. Um, and I'm just thrilled to have him here and excited for you guys to be able to get to know him and just to learn from his years of wisdom and experience in missions. And so, Chris, thanks for joining us.
Thank you very much. Glad to be here.
Yeah. So let's start out here and just have you kind of introduce yourself, share a bit of your background. I know you're with
Sure.
In His Image, and I think people would love to hear a little bit about that organization as well.
Sure.
And yeah, so who are you? What are you doing in missions? And we'll start
Yeah.
there.
Yeah, Chris Jenkins. I'm a family physician. I work with a residency called In His Image Family Medicine Residency Training Program, which is where I also did my family medicine residency training myself. I went into medicine a little bit late. I had gone to seminary and got a couple of degrees, and then worked with an adult literacy organization that was helping mission agencies and national churches start programs for adults in their own countries who tend to be the poorest of the poor and struggle a lot. But putting together literacy materials as well as train the teachers and help them put together programs to teach both Christians and non-Christians to read, to benefit the church and to bring people into the kingdom. During that time, I was convicted that the Lord was leading me into medicine. And so I took a year of absence from work with the permission of my boss to see if I could do it. I didn't have the prerequisite courses as an undergrad. So I did those and that went okay. And then I did the MCAT and that went all right. And did my interview. And then I got into medical school at the University of Oklahoma, College of
Amazing.
Medicine. And I was a late bloomer when it comes to medicine. And then again, I went to In His Image for residency training and stayed on as a faculty member, which I'm still doing, still seeing patients and also doing or involved with their international mission work. I travel frequently each year to do consultation work for graduates of ours and some who are not graduates of In His Image, who are doing long-term medical education work in various countries, primarily in and around the 1040 window,
Okay.
uh, which is where our graduates tend to gravitate toward. And very rewarding work on a personal level, even on the short-term side, and very fruitful for those who are doing the long-term work. So that's a little bit of background. If there's anything else you want to know, I'll be glad to answer.
No, yeah, very cool. And I'm sure we'll flesh some of that out as we go in terms of like the 1040 window and things like that. But tell us a little bit about In His Image. You said you
Mm.
completed residency there. I think many
Right.
people tuning in may not be aware of what that program is all about.
Sure.
Do you mind sharing a bit more about that opportunity?
Yeah, not at all. Some of you may remember that Oral Roberts University had a medical school, which ended up closing in around 1989, I believe. And the faculty of the family medicine residency program at that time decided that they didn't want to quit, so they reincorporated as In His Image. And so it is a Christian family medicine residency program. The fact that we incorporated as a nonprofit religious organization rather than a nonprofit educational organization has
Mhm.
allowed us to recruit faculty who are Christians and medical student graduates who are Christians also to maintain our unique Christian focus and ability to carry out our vision. So our residents are believers, our faculty are believers, and we're able to pursue the visions that God has given us both for domestic missions, which we're very involved in with a mobile clinic ministry to people in and around the Tulsa area called Good Samaritan Health Services, as well as our short and long-term international mission program that we're very involved with as well. We've probably over the years had, I may be wrong in the number, but somewhere between 60 and 80 graduates who have gone into lengthy, I'll put it that way, missions, international missions, anywhere from 2 years to 35 years of mission work. And then
Wow.
everything in between. And I think we probably have about 30 of them out there right now, and others have come back for various reasons, retirement or other reasons.
Yeah.
So we are a 3-year board certified, board accredited family medicine residency program here in Tulsa. Tulsa, Oklahoma. We're a community-based, not university-based program, which means
Okay.
we're not tied into a university somewhere.
Mhm.
We have 10 residents per year, so a total of 30. Uh, and many of them are on a track to go overseas, and some are on track to do domestic missions. So it's quite
Okay.
a great group that we have, and an excellent program if anyone is interested in family medicine and wants to learn medicine as ministry while you're being trained.
Yeah. So yeah, I mean, just a perfect opportunity, right? If you're on
Mhm.
the track to go into medicine and you're looking for a place to do residency and you have a heart and a vision to do missions,
Right.
it's like the perfect scenario there.
We very much encourage our residents to take international rotations while they're here, even if they're not going to go long term. We want them to be exposed to what missions is or are, and even if they're staying, they can be better senders and pray more intelligently for the people who are out there. And this coming year, we have 30 residents. 19 of them will be going on a international mission trip in this coming academic year. I'm not sure what the current number is for this year.
Yeah,
We slowed down during the pandemic like everybody, but we picked pretty much back up, and a lot of people are going each year for a month or more on rotations overseas. So that's it's a great opportunity with us if an individual is interested in doing long-term missions. They get a great exposure and good training even before they're finished their residency for cross-cultural missions.
very cool. Yeah, yeah. So yeah, and we obviously at GMHC really highly recommended him in his image as well as a partner organization of the conference. And
Yeah,
so
yeah,
yeah,
we
just love
appreciate
what
that.
you're doing. So yeah,
Mhm.
it's great. So the topic of conversation today is really centered around healthcare education as a form of missions. So,
Mhm.
we talk about in various conversations and different breakout sessions at the conference, different forms and ways of engaging in healthcare missions and medical education or healthcare education is one of those avenues. So, do you mind kind of giving us just a 10,000-foot view of what healthcare education looks like in a missions capacity?
Yeah, sure. And there's various ways. It depends on the country that a person's in, depends on the specialty they are trained in, depends on the freedom they have to teach locally if they're going to be a long-term missionary. For us in family medicine, it has given us a great door. It's a great door opener into countries that traditionally are difficult to go into otherwise. uh, People in developing countries in particular are concerned about the health of their people. And if someone's willing to come in and do medical education for their own doctors and help them have a better level of training and a better ability to give good care to their communities, then very often they're willing to let people in, even in the most closed countries. We had a program in Afghanistan that started back in 2003 or four and closed the day before it all fell apart in 2021. Our last faculty member left the day before the airport closed in Kabul.
Wow.
So, but they wanted us there. We were training their doctors and helping them, and they could see the quality of training they were given. So it's a door opener, and
Okay.
it's in and of itself, it's a great service to communities that are struggling health-wise because we can help bring better care to them. It wasn't just us in Afghanistan, but the maternal death rate, mortality rate in Afghanistan was very high when
Mhm.
uh, the war broke out there, and different organizations were able to go in. And along with us, others were there too, but the maternal death rate dropped significantly, almost to on par with other countries around the world.
Wow.
Unfortunately, I believe it's beginning to rise again with the current regime there, but can make a great impact on the health of people. And spiritually, it gives us a chance to share what we believe, live it out before them,
Yeah.
and even stimulate questions on their part. Why are you here? What makes you different? Tell me about what you believe. This is what we believe, but what do you believe, and why is that important to you? So, in a country like Afghanistan, you're not able to do that very openly. But if you're there long enough and developing relationships, which is what medical education allows you to do,
Right.
those questions will rise, and you'll be able to share. Now, in other countries that are much more open, like I'll say Papua New Guinea or Malawi, where we have graduates of
Yeah.
us working, they are Christian nations. The depth of their spirituality may not be great in some areas, but the fact that they're Christian countries allows us and our missionaries to be as open and as free to disciple trainees or to evangelize patients and others in the area as they want to be or as they feel free to be. So medical education is a great door opener. Because it's a long-term thing, it allows a person to disciple believers to a depth that wouldn't be possible in a short-term team or maybe in other types of missions. And Well, anyway, it just opens up all kinds of doors for ministry and service and evangelism, as well as discipleship. And again, that long-term presence is what really can make an impact. Short-term trips can be very valuable too.
Yeah.
Disaster relief. We just had a terrible earthquake in Myanmar, and different teams are going in. We're trying to get a team in of our own this week. We're having trouble or having challenges getting visas. But if we can go, we've done a lot of disaster relief trips in the past to help relieve suffering that's acute and bring life, keep people alive or help them deal with chronic conditions. So there's a wide range of possibilities with medical missions, and I know we're focusing on medical education, but just wanted to mention that about disaster
Yeah.
relief too.
No, of course. Yeah, that's a great thing to bring up. But yeah, let's kind of flesh out the difference between other forms of medical missions and medical education as a form of missions. I know you mentioned kind of one piece there in terms of um, the way that it can give you access into restricted areas and things like
Mhm.
that. I assume that's maybe true about medical missions just broadly, or is that unique to medical education as a
I
form of?
think it's broadly. I think medical education has a unique facet to it that allows for a long-term presence where simply doing clinical care may or may not, depends again on the country.
Okay.
But it is a broad thing. I think coming in to give better health, I personally think that anyone involved in medical missions, period, ought to be teaching somebody something to leave
Yeah.
behind what you brought with you, so that when you
Totally.
have to leave, you may, uh,
Yeah.
you don't want a 30-year short-term mission trip, because once you're gone,
Yeah.
everything shuts down. I'm just focusing on the medical side. Certainly on the spiritual side, you can be there for 30 years and have a
Right.
lot take place
Yeah.
apart from medicine. But
And
uh,
we just talked about in a recent virtual event about the importance of exiting missions well, and that the whole point of that conversation was talking about like beginning with the end in mind and what it
right.
looks like in terms of like training and equipping people
Yeah,
who will be there after you leave. So yeah,
sure.
I love that that kind of comes full circle here.
Yeah. But clinical medicine is very important. And if you're a person needing the skills of a surgeon or a doctor and you're benefiting health-wise because of it, you're glad they're there, as a patient, whether it's in
Yeah.
Africa or Asia or wherever you are. And if their own system doesn't have the personnel to take care of your need, you're very grateful, and it makes a big impact on that individual and their families. So I'm not knocking clinical missions at all. I'm biased toward medical education because that's what I'm doing.
Yeah.
So I'll probably speak more highly of that, but I really do believe in the idea of leaving behind by training local people your own skills and your own vision. In some countries, you leave behind the medical part because they're not so open to the spiritual. In some places, you leave both, and you leave behind people who are uh, practitioners, whether in our case they're family doctors, but in other cases surgeons, who not only have the skills to take care of disease, but also the vision to share the faith, the whole person approach, not only the body, the mind, the social parts of life, but also the spiritual. And when you bring that together, you're able to pass that on through education, it makes a tremendous impact, a long-term impact that simply coming and doing clinical work may or may not, it
Right.
might, but it might not too.
That's really neat. Yeah, it sounds like a really special application of missions in that
Hmm.
regard. Just that long term and relationship building that can
Sure.
take place. Yeah,
Yeah.
very neat. So you talked a little bit about I know you mentioned the interest in the 1040 window and like some unreached areas and restricted access. Is there anything else you'd want to add to kind of what medical education looks like in some of these like unreached or hard to reach
Hmm.
places that you haven't shared quite yet? I just want to make sure that we flesh
Yeah.
that much more.
Again, I kind of touched on this with Afghanistan, but if the
Yeah.
country is creative access country with a different religion and different mindset and values, it can be very difficult to share the gospel. And you really do have to work to cultivate relationships that lead to conversations about the faith. That, we, in our work as consultants, we not only consult on the medical training, uh, curriculum or faculty development or recruiting or whatever, and the nuts and bolts of a residency, but we also talk about spiritual curriculums too, and being intentional and proactive about including spiritual training or outreach or discipleship in the very process of educating your doctors. But what a spiritual curriculum looks like and can be very different. And again, using Afghanistan as the example,
Yeah.
basically our advice was just cultivate relationships,
Yeah.
to try to get to know their trainees well outside of the training uh, uh, arena as well, and maybe in social activities, whether it's going exercise together, have coffee or tea together or whatever, just get to know them.
Live life with them. Yeah.
Pardon?
Like just living life with them in
Living
relation.
life with them, exactly. And in that context, you're much more likely to get to
Yeah.
conversations about things that are very important, spiritual things,
Right.
belief and faith and those kinds of things. Whereas in some place like Papua New Guinea, again, using that as an example, we can have a very well-developed structure of morning Bible studies, sharing devotion, what happened on the wards with praying for somebody and maybe somebody getting well,
Yeah.
or someone becoming a believer, or wanting more information, having a defined discipleship program, using your curriculum to develop a heart for uh, pediatrics or service,
Yeah.
maybe incorporating rotations in nursing homes with older people that would give you geriatrics, but also a heart to serve those who are needy and are dependent on others coming to help them. So anyway, you can be as creative as you want, and incorporating a true spiritual curriculum right into the medical curriculum in some countries. And then again, in those creative access ones, you just have to be, and depending on the degree of danger for sharing your faith, you just have to be on the alert more, and there's a little higher stress level perhaps,
Yeah.
and wondering about how long you're going to be able to be in the country or if something bad's going to happen.
Mhm.
So, but again, I can't say that we've been able to get into every last country we've wanted to, but offering medical education has opened the doors into half a dozen very closed countries, difficult to get into countries, and have a presence there that's ongoing for years. And then something like the Taliban taking over again shuts things down. But so there are unique challenges in the creative access countries that you might not find in more
Mhm.
open countries.
Yeah. Okay, yeah, it's great. So one of the on the topic of like evangelism here,
Mhm.
one of the obviously like people tuning in here are all for it, right? It's
Sure.
a part of why we have interest in missions. But from onlookers
Hmm.
outside of like Christian circles in medicine who are aware of what like medical missions is, have
Hmm.
some critique about the concept of medical missions oftentimes where it feels and looks as though it's like somewhat manipulative to like
Hmm.
leverage medicine to share your
Sure.
faith. Like your real
Sure.
goal is to like
Sure.
evangelize
Sure.
versus do medicine. What would you say in terms of like helping people be able to frame that well and
Yeah.
be able to communicate to others who are maybe here
Sure.
stateside and maybe have a critical view towards all this?
Yeah, I think if you take that line or that argument, then
Yeah,
it kind of says that Christians can't do any service for anybody because it might be manipulative.
right.
You can't have soup kitchens, you can't have clothing drives, you can't help the homeless because it might be manipulative.
Mhm.
So and there is a risk, there is a risk on focusing on service as just a tool to be able to set up the ball for an evangelistic pitch, But Jesus was both. He served, he met physical needs, and he preached the truth. He brought the good news, and I think anybody serving human need out of a motive that comes from their faith in Christ is following that example.
Yeah.
And yes, we're open to the accusation of being manipulative, but I don't think that's the case. We truly are serving these, going back to medicine, communities that need medical care. So that's a true service. But it would be dishonest to say our motive to neglect saying what our motivation is. Our motivation is we love you because we know God loves you, and here's why He loves you, and here's what He's done for you. So it all goes together.
So
Uh,
well said. Yeah.
yeah. So I think people who are afraid that serving others might be manipulative really need to say, no, it's part of the gospel. It's not a manipulation for the gospel. It is part of the gospel. Jesus healed, and he met needs, he fed people, he delivered them from demonic spirits, and he healed bodies, and he preached his message. And that's what we're trying to do as well.
Yeah. It's beautiful and very well stated. Yeah, so let's all get good at articulating that. I think it's really good to embody that. It's, I mean, yeah, so well stated. So I appreciate you kind of diving into that and giving us your perspective on that.
Sure.
So how about let's talk a little bit more about discipleship in the
Hmm.
context of healthcare education and
Yeah.
missions. You talked about some different curriculums for evangelism and
Uh-huh.
discipleship. What does that look like in practice when you're educating in medicine and doing like discipleship at the same time?
Yeah. Well, just assuming that for the moment that the trainees are Christians, because that's who you're talking about with discipleship,
Yeah,
you have, in our case, 3 years, 2 to 4 years, depends on the country and how long the training programs are, but
yeah,
2 to 4 years of life with your trainees and who you're imparting medical skills to, but also to model and instruct verbally on how to walk the walk, how to follow Christ, how to take your profession and offer it to the Lord as a service to him to build his kingdom by meeting the needs of people he cares about. And we can model that through our love. We can model that for the patient, our love for the patient, our care for the patient. We can model it by praying for the patient, by including Christian counsel to our patients as well as medical advice.
yeah,
Many of the diseases that people here in the West, in the United States, have are lifestyle related, not enough exercise, too many calories, unhealthy food, and all these things that come in with high blood pressure or arthritis or high cholesterol. So we can give all kinds of medical advice, but we also can give spiritual advice for their welfare that is very practical. So the discipleship takes place in the context of training, both modeling by the missionary's own life, and then having a curriculum where you're actually laying it out, maybe Bible studies that have to do with serving the poor, or following Christ, or how to meditate so you grow in your faith. How to meditate scripturally,
yeah,
so you grow in your faith, why evangelism is important, why purity is important, all the different things that go with being a follower of Jesus Christ. You can all that can be taken, all that can be shared in the process of training a person medically. So
yeah,
it's a wonderful opportunity to disciple a group of people for X number of years, however many years the training program is, and then beyond if they keep the relationship through medical education. So it's kind of goes hand in glove. It's harder if they're not believers.
right, yeah,
Then it's more of an evangelistic thing. You're living your life out so they see that there's reality to the message you're talking about, that your life is different, that you do care for people, that you do live a different life, and hopefully and prayerfully that our lives are consistent with our message, so that our lives are the message as much as our words are. So it's more of an evangelistic thing, but depending on the context, one or the other can be taking place in those 2 to 4 years you're training people.
yeah. Yeah, it's so good. It's, what's coming to mind is you're talking about this in the context of working with non-believers.
Uh-huh.
Was recently kind of working through a course on the book of Ephesians through the Bible Project. If you've heard of the Bible Project, uh,
Hmm.
they offer some free courses in biblical education, and it was really striking to me. They were the way they were talking about this topic of like evangelism came up in one of the course discussions, and I loved the way that they framed it, and it aligns with a lot with what you're saying in terms of like living it out.
Mm.
Basically, what we're doing is giving people a vision
Hmm.
for a new kind of world, like a new
Yeah,
way of being in the world, and like because we're all familiar with the pain and the suffering,
sure.
and it's all even across cultural boundaries and things that the suffering is it's all the same, and it plays out
Pain
in
is pain.
yeah, pain is pain, right? And so we know what it's like to live in this world. And so giving people a vision of something new is
Hmm.
different than starting with you're a sinner and you're in need of saving and
Hmm.
Jesus is the only answer. Like
Right.
first they need to catch a vision of something new. They're well aware of the pain and the suffering.
Sure.
And like through living and through kind of displaying a new way of being, like life in the kingdom, basically living out that vision and
Yeah.
basically just portraying a new kind of world is a way better way in than starting with the problem and trying to offer
Right.
a solution. Like
Right.
it's that vision first.
Yeah, I agree. I think a lot of them wouldn't even understand the problem the way we would understand it biblically come in
Yeah.
and say you're a sinner. Well, what does that mean? Well, what do you mean I'm a sinner? I'm just
Yeah.
living like
It-
everybody else. So, and then
Exactly.
just they would often take it as an accusation that you're a crummy person, as opposed to we all are sinners and Christ came to die for a sin. That's the good news. But again, if they don't understand the problem, then starting with the problem may not be the right way to go about it. You got to get to it eventually. He did die,
Eventually, yeah.
die for our sins. But if there's not a relationship and an understanding, it's very hard to communicate that need to people who don't understand the problem. Yeah.
Right. Yeah. So good. So yeah, I'd love to hear some stories here if you have them. If not, that's fine too. I imagine you have plenty of stories to share. But if you could
Sure.
share maybe some stories of how healthcare education has maybe impacted a national doctor and then kind of led to them being mobilized in missions and maybe something to that effect, if that fits.
Yeah, I'll start kind of a general scenario.
Yeah.
I was in a southeastern country just a month ago in March doing a consultation, and heard some stories of their own work. And this is coming out of their clinic and their training program. Just a couple of stories of how people have responded to the doctors who are believers. It's a country that is 99, pardon me, 97, well, 99% non-Christian, 97% is a majority religion. It's not what you're thinking. It's a different religion.
Yeah.
2% the religion you're thinking, and then 0.3% Christians. And so there's a lot of people who don't know what the gospel is. And so they're training local Christian doctors, so they are able to find some, and they have a clinic and an overnight stay for people who are a little sicker. And so there were these two brothers in the northern part of the country who were very seriously ill. And they were directed to this center. I guess it has a reputation, and so they were directed to this medical center. They were admitted. They were treated well in terms of medically. They recovered, and while they were there, they heard the gospel both through their routine showing of the Jesus film and literature, but also through the lives of the doctors and nurses who were taking care of them. And they became believers. And then so they went back to their home village, hours north of the main city that we were in, and they shared this with their dad, who was an influential member of their tribe. It's a minority tribe in this country. He became a believer. They started hosting Bible studies. And since that time, hundreds of people have become believers in that tribal area, and a church has been started. And they're also reaching out to their fellow tribesmen across the border into the country just north of their own country. So it's without even thinking about it, they're becoming cross-cultural missionaries to their own
Amazing.
people, but there's, tribes people on this side of the border. And the other story, also from the same country, a Southeast Asian country, this is a local uh, national policeman, and he had heard the gospel a couple times through a missionary. I don't think it was one of the medical missionaries. I think it was just another missionary. And then some local believers had shared with him, but he didn't accept it. He was resistant to it. And well, his wife became ill, and so he took her to this medical center, and she got well. And while they were there, they had a chance to hear again the gospel, but this time in the context of people who were living it out and showing the care as well as sharing the message. And so it softened his heart. And so when she was discharged, they went back to their town, which was a little outside of the place where we were. Late at night, he went right to the home of a local church leader, knocked on the door, and said, I want to hear more about this Jesus person. And he ended up becoming a believer, and he ended up becoming a pastor of a local church. So this was a few years
Wow.
ago.
Yeah. Okay.
And then most recently, the same place, and this is all coming out of this educational environment where these young local doctors are being taught how to do good medicine and with their spiritual curriculum, how to pray with patients and lead patients to the Lord. Well, this is a first-year resident in their 3-year program, about 8 or 9 months into her training, who's already led 24 of her patients to Christ just through the routine come and go of clinical care. And she's just a young believer, a young doctor, and already led 24 people to the Lord as of a month ago. So maybe a couple more have been added since. I don't know.
Yeah.
So, and those are not unique stories. I mean, they're great stories, but other places have similar stories. And you asked for individuals. I won't give any names, of course, but out of an East Asia country, there's some folks there that have been working in medical education for years, again, and they call it general practice. But out of that have come trained believers who want to do cross-cultural missions. And so they've developed a pre-field program, both teach them scripture, but also cross-cultural work principles and how to share with someone who's not of the same faith or the same culture and those kinds of things. So they've sent probably half, it's not a huge number, but maybe half a dozen individuals and couples out to Pakistan, to Lebanon, to Japan, to the western part of this East Asia country that is of another faith and a resistant faith to work among them clinically and to have a verbal witness. So it is exciting. So again, when you're there for a long period of time and you have a chance to work with somebody or a group of young people for years, you're going to find people who catch the vision and want to go, and they do go. And we're
Yeah.
there to help them get ready and hopefully not crash and burn out on the
Right.
field. There are challenges. A lot of these countries do not have well-established, well-oiled sending agencies. They're brand new at it themselves. And so some of these countries have made mistakes. They haven't prepared some of their missionaries well before they go, or they haven't known how to support them on the field to keep them healthy, physically, spiritually, mentally, socially. And there have been some failures. I'm thinking broadly, not necessarily of our group, but that's part of it of being in a country long term. You help them develop their own systems of
Yeah.
sending, whether it's medical M's or not, other professions, other skills, how to go and how to keep them out there, how to prepare them, and then support them when they're on the field. So I hope there's a couple stories there for you. I don't know if you
Yeah.
want more, but
Oh, that's awesome. I mean, yeah, just hearing stories,
uh,
brings it all to life and just kind of helps us all catch a vision for what it looks like in practice and the fruit of it. And I mean, it's already just, I'm sure there's a handful of people
yeah.
listening in who will already be
So
inspired.
I'll give you one more story though, anyway.
Please do. Yeah, please do.
So this is not East Asia or Southeast Asia. This is Central Asia.
Okay.
And we have a couple people from a particular country there who actually came to Tulsa and went through our program and went back. They didn't stay. A lot of people stay once they get their foot in the door here because it's so much more easy or more wealth and all this. But they went back and they continued and enlarged a training program that they had developed in partnership with one of our graduates who was a missionary there for about 10 or 11 years. And he came back with his family, but this guy kind of took over
Mhm.
and is running a clinic with Christian doctors and staff and a training program. The training program has been developed, exponentially is not the right word, it's been improved significantly over the years. I think they have 5 or 6 trainees right now, but they've put in another clinical site. So they're ministering to patients as Christian doctors in this non-Christian country, and they're seeing some of their patients come to the Lord. In addition, they do have this training program. So these other doctors are going out and replicating what they learned, and they've also started a couple of home churches, and they invite people who are neighbors or friends, but they also invite patients who seem to be interested. And so they've had a number of their own patients come to these home churches. So this is a great ministry. They're discipling and training young doctors in their own country to be good general practitioners, but also medicine as ministry, to know how to pray with their patients. They're seeing patients respond, and they're starting home churches, and they're opening up different clinics because they're also keeping some of their graduates as additional attendings and faculty in their training program. So it's a very exciting thing to see.
Very exciting.
Yeah.
Yeah, I love too hearing about the development of home churches in these areas
Hmm.
too. Like it's all kind of stemming from these like medical settings and then
Hmm.
really like going out from there just to the day-to-day life and building of
Right.
community and I mean that's the stuff that'll last and have lasting impact and spread
Yeah.
from. So
Yeah, absolutely.
very cool. Very neat. So let's shift gears a little bit. I want to hear your take, and before we wrap up, I know we've got about maybe 10 minutes left, but
Okay.
um, what's your take on the future of medical education in missions?
Sure. It's always hard to say, but as long as there's medical need or healthcare needs, there's a place for it. I don't see that stopping. I mean, missions in general wax and wanes, depending on the situations and circumstances of the time. Some countries have been wide open to having missionaries at one point and then kicked them all out at another point. So you never know what's going to happen, but as long as there's a health need around the world, and and a lack of modern training in those countries, I think the opportunity for medical education missions is always going to be there, whether it's short term or long term. The short term can be very helpful, especially if it's uh, tying into a long term project. My personal work is as a consultant, so I go to where our graduates are and some of our other connections who are not graduates but also doing medical education. I go with I'll take another consultant with me or two or three, and we'll look over the program and then we'll make recommendations. We'll affirm what they're doing well. We'll make recommendations where they could do better or give some ideas how maybe they haven't even thought of certain things to improve the quality of their training, both medically and spiritually.
Mm.
So my role is a short term, and it can be very helpful. And I mentioned this program that I was just with in March. We had done our first consultation there just before the pandemic in the, well, it was March of 2019. We made
Mhm.
a bunch of suggestions. And so now we come back in 2025, first chance we're able to do it. And they implemented a lot of those things, which have improved their training, both medically and spiritually, a lot. And some of those stories I was just telling you come out of that. But we went back and did another assessment just to see where they are and looking at the changes they've made. And then we're able to give another set of recommendations that we just emailed off, I think 2 or 3 days ago to them that will hopefully take them to the next level of training. So there's a role for both short-term stuff and long-term. The long-term, I think, is going to have the biggest impact, but it's my joy and privilege to be able to come alongside those guys and help them make the most of their opportunity, both medically and spiritually. And that's what I see myself doing, that they can get the most out of their time and the most out of their effort to make an impact for the kingdom. And it's we're not member care team. We have a sending agency of our own, and we have a member care team that goes and their focus is on the spiritual and family health of the missionaries. But we're not on that team, but there is a member care component. These are medical missionaries who are pouring their lives into their project, into their work. They got a
Yeah,
lot of things going on with family, their kids, their spouses, male or female. So there are a lot of things that member care teams can do, but they're pouring their effort, their energy, their resources, their thought into their project. And that can become a very emotional thing, especially with a team where maybe members have different ideas of how they should go forward or how they should conduct their program, their training. And
yeah,
so, again, I said this before, we come in and we deal with the nuts and bolts of training and education, and we can make our recommendations, but we also moderate or mediate differences of opinions on the team and give them hopefully a better perspective on how to work together and keep working together.
yeah,
And so there is a kind of there is a personal care element to even doing a consultation on family or medical education, which also is very satisfying because they do have so much of their lives tied up in what they're doing. That's their vision. They're carrying it out. And is it
yeah,
good? Is it bad? Are we doing well? Are we not doing well? Can we do better? Are we doing it right? And to be able to encourage people and assure them that they're on the right track, and if they are a little bit off in their training or whatever, to help them get aimed in a little bit better is really rewarding for me. But again, to answer your question, I think yes, there will be a role for medical education as long as there's a need for healthcare, and as long as there are countries that are lagging behind and don't have available to them the resources or the knowledge or
yeah,
people who are willing to come and stay. Missionaries are the ones that are willing to come and stay for year after year to help people.
yeah,
It's not usually the secular people. There are some, of course. I don't mean to make too broad a brushstroke there, but in general, it's the missionaries who are willing to pour out their lives to help another group of people.
yeah. That's great. Yeah, and I appreciate you diving in a little bit and sharing more about some of the different opportunities between short term and long term.
Mhm.
It sounds like what I'm hearing is that a lot of the short term opportunities will look a lot more like that consultation and like care and support type of roles. Did I hear you right there?
Yeah, and that's not the everything. I mean, you can come in and just like I do a consultation, but you can come in and just teach on a topic that maybe the missionaries want their residents to know. So spend a week or two
Yeah,
teaching on something or a skill,
very
do
cool.
ACLS or BLS or
Yeah,
ATLS or whatever it may be, and teach them some skill that would be more. It would be difficult for the missionaries to pull off either because of lack of resources or mannequins or
yeah,
time or whatever. So they can come in and just teach on a topic They can come in and relieve the missionaries by doing clinical care for a week or two. Well, that's a little bit tricky if the person's not used to working in resource limited countries.
Right.
But
Yeah. Yep.
nevertheless, they can. Nevertheless, if there's a need for coverage, having a medical person come for short term, a week or two, or a month or two or three, whatever it may be, or even a year, that can be a great benefit and blessing to the long term missionaries. So there's all kinds of short term opportunities out there. From what I do as a consultant, to medical lectures, to just doing clinic and giving them a break or
Yep.
whatever. So lots of opportunities short term as well as the long term.
Very cool. So final thing here, where would you point people for some next steps in either short-term or long-term healthcare education as a form of missions? Where's a good place for them to look?
I think the best place is in his image.
Of course. Yeah, of course.
We do a lot of that, and even during our residency training, we have a mission track so that those who are heading out long term can go through that and get a lot of background information, and they can go and see how our long term missionaries do their work. They can go do rotations with them to see how they do work both clinically and educationally, so they can learn it. So uh, I would recommend to people wherever they go to get their training, that they do take a rotation or two to visit long-term missionaries to see how they're doing it. And again, if we're focusing on medical education, those who are doing medical education, we have about a half a dozen different sites right now that people would be welcome to go to with a little advance warning, um, to see what they do and learn from the ones who are actually doing it.
Yeah.
So again, wherever you're doing residency or medical school, I suppose for that matter, try to get a rotation overseas for a month or two to see how it's done. That would probably be the best way to do it, because each country you go to is going to be different. So medically, our residency here trains a person to be a family doctor here in the U.S. We try to do all the procedural things that family doctors do, training in that. But beyond that, we don't really train people how to do appendectomies or something like that, family doctors.
Right.
Because in some countries, they're going to do more than what we do by far, and they're going to have to learn it on the job. In some countries, they do a lot less. I mentioned the Central Asian country with the church planning and all the rest. It's totally outpatient, fewer procedures than we do, office procedures than we do in the US. And so it's a whole different ball of wax. We wouldn't need to learn C-sections to go there. On the other hand, back in Papua New Guinea, even the pediatricians learn how to do C-sections because if you're on call, you have to cover whatever comes in. So they teach everybody.
Yeah.
Internal medicine, they have med peds and internal medicine doctors and pediatricians, and they all are taught to do C-sections by the long-term missionaries. So, what you need clinically in terms of your skill set, you really need to know where you're going to go to know what you need. Medical education, there are degrees in medical education. You get a master's in medical education if you really wanted to go into it that deeply. And there are shorter courses. You can do fellowships in medical education. There's I think a couple of one-year fellowships that you can do that while you're working here in the U.S. And so I think that's about all I know to say. And again,
That's super helpful. Yeah. I mean, just helping people kind of get an idea of where to look, what to look
sure.
for is great. And obviously, to those of you tuning in, medicalmissions.com is a great resource also in terms of looking into the member directory there.
Mhm.
There's 27,000 members there you can look into and find people to connect with and ask questions about. And also the organization directory there too. In his image is obviously um, a perfect example of a great organization in terms of healthcare education, but there's dozens and dozens of other organizations to look into and find a good fit in terms of finding your next step. So make use of the medicalmissions.com as well, just to help find some resources.
Yeah, I think CMDA, Christian Medical and Dental
Yeah.
Associations, also has resources about pre-field preparation and some materials on medical education as your calling in
Yeah,
another culture. So they're a good resource to take advantage of as well.
that's great. So I had one other thing pop up. I know I said last thing a
Okay,
couple
that's
minutes
all
ago,
right.
but I was thinking in turn, a lot of people tuning in are not um, medical doctors, but they're advanced practice providers or nurses. Or what would you say to them in terms of opportunities for healthcare education as missions, particularly like PAs. I know sometimes that's difficult uh,
Yeah.
to work as a PA in missions, just
Yeah.
based on acceptance of license and things like that. But would you say medical education is a good route for some of these other um, types of practices?
It can be, and I can't claim to be an expert on how others in other professions go about education in other countries. I do know there's a great need for physical therapists, occupational therapists, for counselors, psychologists, and counselors. Mental health is as big an issue overseas as it is here, and they usually don't give national governments and ministries of health usually don't give many resources to that because they're focusing on the physical
Yeah,
disease with what resources they have. And so I would just have to say explore. I don't know. I don't have a good answer on how to. I
that's
do
okay.
know that in our programs, we do use nurses, we do use therapists and all the rest to take care of patients. And that certainly supports the educational process of the doctors we're training because then they know how to use and utilize their skills and all those kinds of things. But as far as I don't have a really good path to give to someone to know how to get trained to be a trainer of, say, physical
Yeah,
therapy in another country, even though there's a huge need for that.
yeah,
Um, yeah,
great. More for us to explore. So,
sure, sure.
well, wonderful. Thank you so much for your time. I wondering if you'd be open to close us out in prayer here, and
Yeah,
uh, we'll wrap
I would
up.
love to. I would love to. Thank you, Luke. Father, thank you so much for this opportunity to talk about medical education missions. And I do pray that for anyone watching this interview, that you're tugging at their heart, that they would recognize the call and understand the value of it, and and feel the freedom to commit to missions using medical education to reach people and to serve them, both serving them physically and reaching them spiritually. And I just pray that you would be calling people. And Lord, thank you that you are raising up people to go. Thank you that you include us in your work around the world. And we commit all these things and we commit ourselves to you in Jesus' name. Amen.
Amen. Thank you so much, Chris.
You're welcome. My pleasure.